to the Oral Health Education Series, Module 4, Fluoride, Part 2. I'm Dr. Brecky again, and we're here with Ready, Set, Smile to give you a second lecture on one of the most important topics of oral health and dental care, and that's fluoride. So let's review. What have we learned thus far? Fluoride is a key solution to our problems. Fluoride is a naturally occurring element found within water supplies across the world. It also has decay-fighting properties, including promoting remineralization of the dentition and tooth structures, inhibiting or preventing demineralization or breakdown of tooth structure, and directly disrupting bacterial synthesis. That means getting rid of those bacteria that cause cavities or dental decay. Too much fluoride ingested, though, may cause fluorosis of the dentition or a variation from normal of the color of the teeth. It isn't dangerous necessarily, however, it just doesn't look great. So, reducing the amount of ingested fluoride for young children when their permanent teeth are developing is key. Now, lastly, fluoride is a safe, inexpensive, and effective preventative agent to reduce the prevalence of dental caries on both individual and on population levels through things like toothpaste and community water fluoridation. So, why should this matter to you? Well, certain groups are at increased risk for tooth decay or dental problems, and these groups would most benefit from fluoride supplementation or use more diligently than others. Access to fluoride may be achieved different ways, both at home and even in a medical office setting. And lastly, fluoride is a very useful and effective tool for prevention of dental disease. That's where you come in, because if we can educate others to use fluoride and to feel comfortable with using fluoride, we can really avoid a lot of problems related to teeth. So questions you might have to start off with. Are there other agents to remineralize teeth? Who needs fluoride the most? Where should we be getting fluoride? There are so many fluoride products out there. What should we be looking for? Or what would my primary care provider think about me using fluoride? So at-risk groups who would most benefit from fluoride include children, infants, young children, and even adolescents. They do tend to have poorer oral hygiene behaviors, and they also learn those behaviors from their caregivers, who sometimes don't have the best practices to teach little ones. Those with a history of dental caries are very prone to having future dental decay issues. So they are also really would benefit from increased fluoride use. Children with frequent snacking habits, those who dwell in rural areas without access to community water supplies, those with low family incomes or socioeconomic status, lower education of caregivers, those who don't have the knowledge to know about fluoride use or the means to achieve it, and also children who have natural deep grooves or pits and fissures in their teeth, especially the molar teeth in the back. Those with developmental disorders or special needs are also at increased risk for issues and would most benefit from really great fluoride use. And lastly, mobility issues, especially children who have trouble brushing teeth on their own. At-risk groups who would most benefit from fluoride also include adults, but specific subsets of adults. Those with poor oral hygiene behaviors, maybe they never established them. Maybe they recently got worse, especially if a person has mental health issues or anything like that. Those with a history of caries, again, are at very increased risk of having caries in the future and would really benefit from increased fluoride use. Frequent snackers, rural dwellers, low income, SCS, as we discussed with children. Those suffering from xerostomia or dry mouth. Autoimmune conditions, older age, or even if they just take many medications, xerostomia plays a huge role on a person's susceptibility to dental decay. And those people who don't have great saliva flow would really, it's important that they use more fluoride than others. Head and neck cancer patients with a history of radiation to the head and neck, that can actually destroy the salivary glands and again, create dry mouth. So those patients specifically typically use fluoride trays and professional prescriptions of fluoride to take care of their teeth. Those with exposed root surfaces, we've talked about before, gingival recession, when the gums recede from the tooth, exposing that softer root structure. Those areas are at an increased risk for problems and would really benefit from more fluoride use. Those with GERD or reflux disorders, problems with erosion such as eating disorders, bulimia, etc., those patients also really need to increase their fluoride use at home. And lastly, often older adults or even adults with special needs, those who are institutionalized or living in homes, sometimes may not have the help that they need to take care of their teeth, in the morning and at night. And using fluoride would really benefit them. And again, those with mobility issues who cannot care for themselves, especially the disabled. So we'll go over the 3 modalities where fluoride is achieved, whether it's in an office, through the water and diet, or at home via hygiene practices. So at-home treatments. How do we take care of our teeth at home with fluoride? Well, toothpaste, number 1. Most toothpaste do have fluoride. Look for the ADA approved seal. There are often, there are toothpastes out there that don't have fluoride, but you typically find them at Whole Foods or things like that. We do recommend using fluoride. Mouth rinses. Not all mouth rinses contain fluoride. Those like ACT or restoring mouth rinses, you really have to read the label to see if they contain fluoride, because a lot of mouth rinses out there do not contain fluoride. And we really strongly do recommend for all patients to use mouth rinses with fluoride for any patient who has teeth. Prescribed fluoride aids. There are fluoride aids that you can get from your dentist or even your physician, whether it's a prescribed toothpaste at a higher prescription of fluoride, fluoride gels, at-home trays and treatments, things like that. Talk to your provider to see if you're interested in something like this. So what's actually in your paste? Well, there's a few different types of fluoride that are within fluoride agents: sodium fluoride, stannous fluoride, olefluor, sodium fluoromonosulfate. Whoa! These are giant words. Look on the back, read the label, see if it has fluoride. Make sure that it works for you. Some people do have little contact dermatitis allergies to certain toothpastes, and whether it's something, the fluoride in there or not, just find a toothpaste that works well for you. You may have to try a few different brands, and make sure that you are using one with fluoride. Like I said, what's the best paste? Whatever kind you like, really, as long as it has fluoride. If you're using it twice daily and it has fluoride in it, we are happy, your teeth are happy. Please keep doing so. But again, look for the ADA seal of approval if you're concerned. So fluoride toothpaste, how much is too much? Well, this is typically an issue for younger children, more so than it is for adults. Again, we don't recommend anyone eating toothpaste, but for little children, this is where we really, really want to make sure they're not getting too much fluoride ingested. So for children ages 0 to 3, we recommend using a smear of toothpaste at the onset of first tooth eruption. For ages 3 through 6, you can use a pea-sized amount of toothpaste. And again, just monitor, tell caregivers to watch their kiddos just to make sure they are spitting it out afterwards. Ages 6 and older, we recommend a normal amount of toothpaste. And for ages 8 and older, a fluoride mouth rinse is even recommended. Remember, it's that age 8 when most of the adult teeth are typically developed underneath the gums, and so, too much fluoride is a little bit less of a concern for fluorosis to those front teeth. So just a brief splash about mouth rinses. Most mouthwashes do not contain fluoride, as I've said. For children ages 6 and older at high risk for dental caries, fluoridated mouthwash is recommended at least before bed. Remember, no eating or drinking 30 minutes after using a fluoride mouth rinse. This is strongly recommended because it will help to keep those teeth strong. Brands like ACT or other alcohol-free high fluoride content products are the best. I usually look for the Walmart, Walgreens, Target off-brand versions of ACT. They tend to be a little less expensive. Remember, and I'm not promoting any one party with these lectures. So anyways, so remember, the risk of fluorosis typically disappears around age 8 for those permanent teeth. So that's when we really do recommend, when a child is younger and they haven't established great oral hygiene behaviors, do please provide them with a mouth rinse and just make sure they're not swallowing it. So at-home natural supplies of fluoride, this is your food and your drink. So your tap water, your diet, and your foods. Remember, if you aren't living in an area which has fluoridated water, then supplementation could be considered for infants and young children. Talk to your doctor about this before deciding to supplement. And just be wary what you're eating. Processed foods often do contain a little bit of fluoride from wherever they were manufactured. We do recommend sticking with whole foods as a part of your diet. So the supplementation recommendations for little ones, you can see this diagram here. Again, please speak with your medical provider before choosing to supplement your child, even if you do live in an area without fluoride in your water. And just remember, everything you eat, fresh veggies, processed foods, you name it, may provide minute amounts of fluoride, depending on where they were developed or where they were grown. So keep that in mind. You may be getting fluoride from your diet as well. And drink more water, right? Isn't that the recommendation? Yes, but not bottled. Again, unless we're talking about reconstituting baby formulas. I'm not even going to bring up the Great Pacific Garbage Patch, but not bottled if we can avoid it. It's good for the environment and it's better for you. It's important to educate others that U.S. water supplies are safe and tap water should be consumed. Bottled water usually does not contain fluoride. So, if you're worried about your local water supply, talk to your local community leaders and see how much fluoride is in your water, what kind of fluoride, or if it's in there at all. Educate yourself. And again, try to reduce the Great Ocean Garbage Patch. Lastly, in-office treatments. What once was fluoride trays provided in the dental office has been predominantly replaced by something called fluoride varnish. It's quick, it's easy. All you do is paint it on like a little paintbrush, and let it dry essentially. But it does require a certified health professional to apply it, okay? There's also fluoride-containing restorative materials, so certain fillings, especially something called class ionomer, does contain fluoride, and it can slowly release a little bit of fluoride into the tooth structure to keep it strong. Third, something called silver diamine fluoride, it's been around for hundreds of years, and it actually helps to stop cavities. Again, it's just as easy as painting it on. We'll get into that in detail. So what's fluoride varnish? This photo is obtained via 3M, again, not supporting one certain party, but it's an in-office fluoride treatment, and it's a high concentration of fluoride, usually about 5% sodium fluoride, which is painted on the teeth at the end of a dental checkup. So patients are typically instructed to refrain from eating and drinking for 30 minutes after fluoride varnish is applied. And the aim is to really re-strengthen enamel and prevent tooth decay. It can also possibly halt and reverse existing caries or decay or any kind of demineralization of teeth. So, wow, did you know your general healthcare team can actually provide fluoride via fluoride varnish? Physicians and primary care providers have the ability to provide fluoride varnish every 3 months to children 6 years of age and younger, via recent Medicaid reform nationwide. So the ADA and CDC recommend that fluoride varnish is provided at least twice per year. In the state of Minnesota specifically, for those Minnesota listeners, it is a requirement for child and teen checkups to provide fluoride varnish at every visit from the eruption of the first tooth to age 5. Older children and teens should also be provided if they do have additional risk factors. So keep in mind, if your physician asks about fluoride varnish and your child is in need of fluoride varnish at that time, don't worry, it's just a great place. You avoid a trip to the dentist to get a little benefit from fluoride. So third, another in-office treatment, and this is at the dental office, something called silver diamine fluoride. It's a different variation of both fluoride and silver ions, which work together to halt cavities. It's very minimally invasive, and it actually stops tooth decay. So it is called a caries arresting agent. But wait, there is a catch. It stains teeth permanently black. And I mean black as night black. So, who might benefit from this? And why would somebody want something that stains your tooth completely black? Well, very young children, adults and children with special needs, or maybe like older adults in long-term care settings. Any individual who cannot tolerate dental treatment well could very, very much benefit from silver diamine fluoride. It might not look pretty, however, it does stop cavities in their tracks and can really help to prevent some of the severe consequences of untreated tooth decay. So here's a brief picture of the application of silver diamine fluoride. This photo is obtained via Elevate Oral Care, which does actually sell silver diamine fluoride in the US, but just know silver diamine fluoride must be applied very carefully and only in a dental setting by a licensed dental professional. This black staining is permanent. Can it be taken care of and treated with a filling later? Yes, absolutely. But the goal is to stop cavities in their tracks. So as you can see, for young children who don't tolerate dental treatment well or can't sit still or are traumatized by the thought or practices of, a filling, silver diamine fluoride is a great option. It has been used in other countries for hundreds of years, and it really, really is a great, great way to stop cavities. So let's just compare quick. Conventional treatment versus silver diamine fluoride application. Conventional treatment takes about an hour-long appointment with numbing medicine. Yep, that's a needle. Drilling, loud noise, filling, and a lot of water. There also might be some post-operative pain involved, and the cost is about $150 to $250 depending on where you are for the patient or the caregiver. Now, on the other hand, in the right column, silver diamine fluoride application. It can be a 10-minute appointment or less with no numbing medicine. You may get a little bit of an icky taste on your tongue or some minor gum irritation for the next couple of days. The cost is typically around $25 to $50. And again, it's perhaps a lot less traumatic. Now, it does come with severely blackened staining on your teeth. So, silver diamine fluoride is a minimally invasive, lower cost, and just as effective for mild to moderate caries. So, recommendations for caregivers of infants and children. So, number 1, nursing is recommended for moms. If using infant formula, do reconstitute with, concentrated powders or liquids with bottled water just to ensure that you're not receiving too much fluoride for the child. Put babies to bed with only water in a bottle. And always, always choose tap water if you can. Ensure adequate fluoride intake and establish routine dental and medical care checkups. Please do pursue that fluoride varnish when it's offered. Lastly, begin using a smear of toothpaste after the eruption of a first tooth for your child. Just make sure that they're not swallowing it. And as I've said 3 times already, the risk of dental fluorosis in the permanent teeth disappears by age 8. So for older children and adolescents and adults, it is recommended to consider a fluoride mouth rinse to your oral hygiene routine in the morning and definitely before you go to bed. So recommendations for caregivers of adults and elderly. Yes, There are more caregivers for adults and elderly, almost as much as there are caregivers for young children in the United States. So consider electric toothbrushes for these older patients if dexterity issues exist and they have trouble taking care of their teeth on their own. Establish routine care with a dental office if possible. Consider prescription fluoride mouth rinse twice daily, especially if xerostomia or dry mouth arises. And remember, dry mouth is a side effect of many medications, so it is very, very common in the older adult population. Consider silver diamine fluoride if caries occur and a patient is in a state of where palliative care might be the best option. Silver diamine fluoride is easy and it works. So please do educate, your friends, family, colleagues, and patients about this, and have them consider this option if they do suffer from dental decay. And lastly, choose tap water. So, some public health initiatives in place to promote fluoride. We'll end with this. There's community water fluoridation for one. Fluoride varnish applications in medical offices, as we've described, or even in school health settings. Fluoridation of salts, which is a common practice in other countries. Or just simply oral health education, and that is you. You are the educator, and we are so grateful to have you helping to educate others about fluoride. And importantly, supporters who do, cite their strong support of fluoride include the World Health Organization, the American Association of Family Practice Physicians, the American Dental Association, the American Public Health Association, the Center for Disease Control, and the Institute of Medicine. And this is not a complete list, but just some of the biggest players for those who promote fluoride use. Always learn poems by heart. They have to become the marrow in your bones. Like fluoride in the water, they'll make your soul impervious to the world's decay. Janet Finch. So, it's important. Focus on prevention instead of treatment. Remember, fluoride is safe and it's effective. It is a cost-effective method to avoid pain and problems later. And it can really, really help others, especially those with limited access to dental care and oral health education. A smile is the prettiest thing you'll ever wear. Thank you to our sponsors. With questions regarding this module, please contact BreckyHuddleston@gmail.com. And we will see you next time. Thanks for joining.